We are covering Medicare overview and eligibility, a critical topic for the health insurance licensing exam. Medicare is the federal health insurance program for people who are 65 or older, and it also provides coverage for younger people with certain disabilities or medical conditions. For the exam, you must know the 4 ways an individual can be eligible. The most common is turning age 65. However, the test will absolutely try to trick you with the other qualifiers. A person under 65 can be eligible if they have received Social Security disability income benefits for 24 months. A classic exam question will present a scenario where an individual has been receiving disability benefits for only 18 months and ask if they are eligible for Medicare. The answer is no, not yet. The other 2 under 65 exceptions are for individuals diagnosed with either end-stage renal disease, also known as ESRD, or amyotrophic lateral sclerosis, which is ALS or Lou Gehrig's disease. People with ALS or ESRD do not have to wait 24 months. Now, let's break down the parts of Medicare, which is a guaranteed topic on your exam. Part A is hospital insurance. It covers inpatient hospital stays and skilled nursing facility care. For most people who turn 65, Part A is premium-free, provided that they or their spouse worked and paid Medicare taxes for at least 10 years. Part B is medical insurance. This covers doctor visits, outpatient care, and preventive services. Unlike Part A, Part B is optional and requires a monthly premium. The exam will test your understanding of this key difference. Part A is often automatic and free, while Part B is voluntary and has a cost. Part C is known as Medicare Advantage. These are plans offered by private insurance companies that bundle Parts A, B, and usually Part D into one plan. Finally, Part D is for prescription drug coverage. The simple way to remember the parts is the phrase, "In the hospital, you see a medical doctor for an advantage with drugs." Hospital for Part A, medical for Part B, advantage for Part C, and drugs for Part D. Another heavily tested area is enrollment. The most important period to memorize is the Initial Enrollment Period, or IEP. This is a 7-month window that begins 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. For example, if a client's birthday is in May, their IEP runs from February through August. The exam loves to give these date-specific scenarios. Missing this window without having other creditable coverage can lead to a lifelong late enrollment penalty for Part B, a fact the exam will expect you to know. So, to recap for the exam, master the 4 eligibility rules, especially the 24-month disability waiting period. Know the difference between premium-free Part A and premium-based Part B. And finally, memorize the 7-month window for the initial enrollment period. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.